Hi there, we are coming to you live from Philadelphia here with our patient Christy, who has welcomed us into her home and is here to share with all of you her story, her recovery story about ultimately what brought her to HSS, what her condition and treatment was like, her relationship with her surgeon, and any questions that you might have along the way. Christy's been generous enough to sit here with us and is more than happy to answer questions. And of course, at any time, please be aware to make sure to always check with your physician if you're looking to start or change your treatment. But yeah, let's go ahead and get started. So Christy, thank you again for having us here.
Thank you. Thank you for asking me, because I had such a wonderful experience. I appreciate the opportunity to hopefully give a little back and let others know, just how wonderful an experience it can be.
And we actually found out about your story from our Back in the Game patient forum,
Okay.
which you are now one of more than 1,700 patient stories.
Okay.
And that's hss.edu/back in the game if you want to learn about more stories such as the one Christy is going to share with you today. So why don't we jump right into that story? Why don't you start from the beginning and share with the audience a little bit about what happened?
Yeah, so it was a beautiful spring day, and I was on Miami Beach and taking a bicycle ride that is, and I was trying to get off of the beach actually itself, going towards the boardwalk, and there was a group of people, and another cyclist was coming my direction. They weren't moving. The group of people had no idea the cyclist was coming, and I had to make a split decision. So there was a tree on the right-hand side, or going off of the sand mat and going to the left to avoid the group of people and the cyclist. So that's what I did. And I tried to hop off my bike as I was doing that, because I knew the sand was fairly deep, but I couldn't do all of that as quickly as I wanted to, I guess. And so when I put my foot down in the sand, my right leg, it went very deep, and my ankle twisted and actually dislocated, and then the bike fell over on that leg, and I fell over with it. So
were you by yourself?
I was by myself. I was making the turn to go back home, actually. So the cyclist went on, and I guess I'm the kind of person, I didn't scream out or anything, because I got very focused on, okay, I'm by myself, I've got my cell phone, but I've got to take care of this. So the group had just walked by, and then somebody saw that I had fallen and I wasn't getting right up, and they said, "Are you okay?" And I said, "No, I'm not." And so I was already calling 911 on my cell phone, and then that group came back for just a moment, and I said, I'll be fine, to go on. And in a matter of minutes, the lifeguard showed up, and he was extremely good. I don't even know his name, but was extremely good, and popped my ankle back into place, because it had in fact dislocated. And then the paramedics arrived and helped get me up, and they couldn't understand why. They said, "Are you going to be okay? Do you need to go to the hospital?" I'm like, "Oh no, I need to go to the hospital." And I couldn't understand why they kept asking that, but I thought, oh, they didn't see my ankle dislocated.
Right.
So.
And can you describe that level of pain that you were going through?
It was painful, but it wasn't. Again, I think I'm the kind of person that, I don't know, I focus on the moment, and okay, you need to deal with getting yourself, out of the moment. So they loaded me up, took me to a local hospital, where they, looked at it, took many x-rays, of course, and found out that it was a spiral break of my fibia. So, and of course the dislocation was problematic as well. So I waited for the orthopedist there then.
And what did they recommend when you met with them?
Well, the orthopedist never showed up. So it was a Sunday. And so right away I wasn't impressed by that, because I sat there for 6 hours. The resident was wonderful, though. She was very attentive, was very upset that she couldn't get an orthopedist in. And finally, one of the orthopedist residents came down to see me and put it in a soft cast so that I could leave, because I said, okay guys,
Right.
it's been fun, but it's time to go, you know. So I was leaving, and I had a friend come pick me up. He was kind enough to come get me and take care of me. And so I already knew that I didn't want to stay in Miami, and the resident had advised me that, you know, look, you're going to have surgery. This isn't a kind of break that we just let it heal on its own, because
Right.
it is a spiral. And so I had already started to think about, where am I going to go?
And so you were able to travel back to Philadelphia.
I was.
And then, you know, when you thought about options, because obviously there's many options, whether it's in Philly, New
Yes.
York, you know, Baltimore's not too far away.
Oh, yeah.
What was your thought process on how to find?
Well, actually, it's ironic in some ways, because my father had many orthopedic issues over the years, and so his doctor actually is the chief of orthopedics at the Mayo Clinic. So I knew that, you know, we had contacts, and I could call and I could go there, but I also knew there would be a rehab and a follow-up, and I thought, wow, getting to Rochester, Minnesota, not what I was looking to do. So I reached out to a friend that lived in Philadelphia who knows a lot of the doctors, very well connected. She gave me recommendations, and then my friend who'd actually brought me home, Danny Akel, he had, which I knew, he'd had a severe sailing accident probably 13 years prior, where he broke both of his bones in his leg, and it was Dr. Levine that put him back together. And I knew how he functioned every day. He was on his feet, you know, having to lift and do lots of things. And so I thought, wow, if he's been able to successfully recover, you know, then this makes sense for me. Let me see if Dr. Levine is even still at HSS
Right.
and still practicing and all of these things. So just, you know, things just kind of aligned. And so that, you know, I got home in Miami and made the call the following day to his office, and they looked at my records, you know, within an hour. They had called me back and said, Dr. Levine can help you. He wants to help you. You know, can you be here on Wednesday? It was Monday. And I said, yep. So we made arrangements. My friend went with me, and I flew direct from Miami to New York, to his office. And, you know, obviously he saw me, and then
Right.
we did the MRI and prep for surgery that hopefully was going to happen on that Thursday.
And for those who don't know, because you live in both Philadelphia and Miami,
Yeah.
For those who don't know, so HSS is about 2 hours or so away from
Yeah,
home.
yeah.
So when you had done your research on Dr. Levine, and obviously you knew
Yes.
about this through your friend, and again, Dr. Levine is a foot and ankle surgeon at the hospital for special surgery. Did you do any research on, you know, Dr. Levine, the hospital, or were you already, like you mentioned, well informed?
Well, a couple of things. My friend's word for it, and given the severity of his accident, and how well he was walking, like he's had no issues, spoke volumes to me. Number one. And then number two, when I actually went on and did some research about who were the top ranked hospitals and did some reading, HSS came up time and time again. And Dr. Levine had great reviews, and you know, speaking with the women in his office that are fantastic. They're on top of it. You know, they do what they say they're going to do. Calls get returned. Everything happens just like clockwork, and I so appreciate that. So I was so impressed from the very start. And then once I went to meet him on that Wednesday at my appointment, that was it for me.
What was that first impression like?
Because he's so personable. And one of the things that struck me about him is he is so personable, but he still loves what he does. And I'm a very, you know, I'm the kind of person that's interested in a lot of things. I work in the chemical industry, and I've done work in the pharmaceutical industry, and so I have a natural, I guess, affinity kind of in the medical field, and so I'm like, okay, tell me everything that's wrong and please explain it to me. And he explained it in detail, and I could see the excitement when he was explaining that to me, and I thought, to me that speaks volumes when someone who's, probably maybe, I don't know, 20 years into his career, whatever it is, and he can still be that excited to explain, that kind of a problem to a patient. That means a lot to me. It shows me he's dedicated to what it is that he does, and he just loves what he does.
So you were sold on Dr. Levine and
Absolutely.
sold on HSS, and so at that point, what did he diagnose and recommend?
Yeah, so I had a dislocated ankle, I had a spiral break of my fibia, and then there was this little tiny bone that's connected kind of in the back of your ankle that I had crushed that kind of keeps all the tendons working properly. And so he suggested that I have surgery, and they were going to put a metal plate and screws where the little bone is, and then as well as supporting that fibia to help it heal. And so they were going to try to get me in on that Thursday, but they already had a full schedule of surgery. And I said, okay, we'll hope, but things don't always work that way.
Right.
So then I waited until Tuesday, that following Tuesday, and was the first patient in, and it went exactly how he said it would go.
Did you have any nerves going into it? Had you had surgery before on this level?
Never. So the worst thing that I had ever had was a couple of wisdom teeth cut out. So there was a part of me that was very nervous, but then there's another part of me that was saying, well, what are you going to do? You have a broken leg, you have to get it fixed, right? So you just take deep breaths and you trust, and I thought, I've done the best I can do. He's, every impression I've had of him was excellent. So, I'm making the best choice possible, and the rest is between him and God, and, me trying to do my part in rehab.
So you go through the surgery, and then afterwards, Dr. Levine comes to visit you, and
yes.
What did he tell you how the surgery went and all?
Well, yeah, so it went really well. I woke up, because you do it as an outpatient, which may surprise a few people, but if you have no issues, you go right in first thing. And I think we were leaving the surgery center by 12:30 or 1 o'clock that day. So so everything just went exactly as it was supposed to go. And I got sent home, and so my friend had come, and we just had a car that brought us back and brought me back here. And obviously stopped and picked up a few things along the way that I was going to need to rehab during those days, but and then just got settled in. So
what did Dr. Levine share with you in terms of the recovery?
Yeah, so it went exactly as Dr. Levine told me it would go, and so that was the great news for me. So it was definitely the first 2 weeks, propped, and they don't want you moving. And then after that, there's a series of exercises and things that I had to go through, and I was moved from a cast to a soft cast, really, to a boot. And you're all excited when you're going to get that boot. And I was like, yes, you go back after 2 weeks, and they look at it, and they put steri strips on, and the major wrappings all come off. And you're all excited because you think, wow, this is great. Mm-hmm. And then you realize for the first time you're going to expose that leg. And they want you, to take regular showers, which is wonderful on one hand. But now you're getting yourself in and out of the shower with that leg exposed.
Right.
And you're trying not to re-injure it. So, and you just take your time and you do those things. But I guess I'm saying that because there's such a mental aspect to it. And probably up until that time, I hadn't given that side of it that much thought. How much mental preparation you needed to have, really.
And how challenging? So you've talked to us about your active lifestyle and all.
Yeah.
So just how challenging is that process, both the mental and physical side of things?
Well, there's a couple of things going on. So I traveled extensively, and it's international travel and everything for my job, and it's like you hit a brick wall because you're not going anywhere. You're staying put. So there's that element to it, but then the other element to it is, like I said, just the kind of the emotional side of it, that you're thinking, okay, I've got to try to get this leg better. I don't want to re-injure myself. I don't want to make the situation any worse, and you're not 20-something anymore.
Right.
It's somewhere along the way that invincibility factor comes away, right? Where okay, things can happen and accidents do happen, and you want to be sure you get fully recovered from them as quickly as possible. It did. Everything went exactly as it was supposed to do. I followed the instructions. I did the little exercises that Dr. Levine and Lisa Pearson, his PA, who was wonderful too, by the way, instructed me to do. And so I really didn't have any issues, and I feel very blessed by that, to be honest. And so, it was just a good experience. And I think if people are watching and tuning in, maybe trying to make that decision, I could not more recommend something. And I'm not easily pleased. I have very high standards, and I could not be more impressed.
And when you went in for, even prior to the surgery, and asked Dr. Levine and his staff questions, or even after the surgery, what were some of those top questions that you were asking them about?
Yeah, so the first one was, how long till I walk again? That was the first one, right? Because that's the obvious one. And he told me straight up, he said, it's going to be 6 weeks, and then we're going to start allowing you to do some weight bearing, and we'll see how that goes. And so by the time I did full weight bearing, I was another 4 weeks after the 6. So you're 10 weeks before you're fully weight bearing on that leg, at least in my situation, with the injuries that I had. And it's that, oh, you're so excited, and then it's like, oh, I have to, I've got to walk on this, and so it's a good process. I followed what my physical therapist had me doing. There was exercises, obviously. I think I went in 2 times a week. I had a lot of scar tissue kind of in my ankle area, because where the break was close to my ankle area, so everything was kind of regionally located.
Right.
But my physical therapist did a tremendous job in using this scraping tool to break all that up and get my ankle moving in full range of motion, and then you do the work to get yourself back. And
you were your rehab was here locally in Philadelphia, and then you went back to Dr. Levine's office.
I did for follow-ups.
Did you drive? Did you take the train?
I the first one, I took a car service back up because you're still in a cast, and so it's difficult just to get moving around, right? And then the second follow-up, then I actually had a friend came and drove me, and then I think the third one then is when I took the train, and then I think I had one more after that, if I remember correctly. It may have been 2 more after that, and I took the train.
Again, and any hesitation about going from Philly to New York? Was it just you're on the turnpike and you're there in a heartbeat? No, I'm used to going to Philly to New York, but so it wasn't any big deal. And actually, it was a little bit of a comfort to know that, hey, I can just jump on the train. I know, I think most people that live in Philadelphia, at some point in time you've had to take the train, I think, to New York, right? So there's a comfort level in knowing how that works and where I need to go, and you get off, and it's easy to get into a taxi or call an Uber or whatever it is that you want to do, and then you're right there at HSS, and you go right up, and that's the other thing, like your appointments are set.
They happen when they're scheduled to happen. It's not, okay, we'll show up at 9 o'clock and then eventually they see you at 1 p.m. No, you know, you're seen in the relative time frame of when your appointment is, you know. So everything works like clockwork, I think is the best way to describe it. And I value that because I think it speaks to then all aspects of the practice itself and how HSS works.
Yeah, and I know from a convenience factor, just myself as a native New Yorker, I don't have to just jump on the train, come down for a cheesesteak.
Yes, exactly.
As it relates to the rehab, so what specifically were some of the things that they had you go through?
Yeah, so there was a lot of, that was very mentally challenging as well. And I would say that was the worst part of it, was the mental challenges. Because at some point, you get to the point where you're hopping on that injured leg.
Right.
And that, you know, and obviously I'm not a tiny person either, and I'm thinking, okay, you know, is this going to be okay? And of course it is. It's more than okay. And I didn't have pain, I didn't have anything, but it's the overcoming that mentally. But I knew that I needed to do that.
Right.
You know, because I just wanted to get back to the point where I didn't think about my injured leg, that I just went out in the world like I did prior to the accident. And that day did come. Now, you know, and it came sooner than later, because it's hard to think back. I know you were asking me beforehand, like, when did all this happen? And it's like, well, I had to think a minute. It's April 2015. On one hand, you know, it's a little over 2 years ago, but but in some ways I feel like it was, you know, it's a million miles away, right, you know, or many, many years ago from when it happened, because you just pick right back up and life goes on and you start doing the things that you love to do, and you realize that you can more than do that.
And so were you on crutches, a walking boot, a scooter?
Yes, all of those. So I got a scooter fairly early on. I got a scooter so that I could just get around even when I was waiting in the hospital hotel. And that was smart because, and as you can see, my apartment thankfully is set up for that. So that was a godsend. So I had the scooter, and then I also had crutches. And I did the new crutches, these things called Moby legs, which, you know, are fantastic because I've been on crutches before, you know, kind of growing up, because I played a lot of sports and, you know, things. But these really have, I'll say, revolutionized crutches. So it makes it a lot easier. But yeah, so I did that. I would walk up and down the hallways here to get a little exercise, and then there's a workout room downstairs which I would utilize as well, in addition to my physical therapy. But I did a little bit of extra, but I wouldn't say that, you know, I went way above and beyond what was prescribed for me to get myself back.
So tell us, so from the time you had surgery, which I believe you said was in March.
It was, yeah, so, well, I think it was early April, I think, of that year, because it was right after Easter, 2015.
2015. Right
after Easter, yeah, was when I had the surgery.
And from that point until you're back to...
So by the time I'm walking, then when I'm putting full weight on the leg, and I'm still in a boot, but it was 10 weeks, full weight.
And everything went according to what Dr. Levine shared with you?
Absolutely, absolutely. You know, the thing that I'll say too is, because this is unique in my experience, is you know, at very early on, when I had just gotten the stitches out of the incision area, I had just a little bit of seepage coming out, and so I asked, you know, I didn't know if I should put something else on it, because they had said basically take everything off and just soap and water and keep everything clean. And so I had contacted Lisa Pearson, the PA for Dr. Levine, and she actually responded on her personal cell phone. She wanted pictures, so I sent her, you know, it's so easy, right? Snapped on my phone, I sent them to her. She could see them right away, see what she asked, a couple of questions, And, you know, she's like, you're good, just keep it clean. You know, you may want to put a little bit of like aquifer or whatever in there, but you're you know, you're fine. It's to be expected. But she did it after hours. I happen to know she was riding the train home, and I just appreciate that level of dedication. She could easily have had me wait till the next day,
right,
and answer me when she get back in the office, and you know, but that commitment, that dedication, caring about the patients, you know, that just, it meant a lot to me. It was small, but it immediately relieved my little concern that I had, and life went on.
So just in the couple minutes that we have left here, how are you today?
I'm wonderful. It's good. I don't even think about it. You know, I go and do, and you know, I just had my sister and brother-in-law came to visit. They live in North Carolina, and you know, it's nonstop, because when people come, you know, they just don't want to sit in the house, unfortunately. So we went and did a bunch of things in the area here where you're up and walking and standing, and you know, it's not a normal routine. You're very active. And then we did New York for the day, where it's, you know, you're walking everywhere and doing all these things. And, you know, and then there was a third day where we did Longwood Gardens, and you're walking and walking. So no pain, didn't even think about it. Just like anybody would, you're thinking, okay, I want to wear comfortable shoes, but otherwise, you know, I'm going to go and do just like anyone else would go and do. So, and I did. And it was no issues, no problems. And again, I feel like I have HSS and Dr. Levine and all of the people there to thank for that. I just don't think about it. I go on with life.
And before we sign off, you know, to anyone tuning in from Philadelphia or the area as a whole, what advice would you share with them if they were looking for care? Because we mentioned earlier there's many options.
There are many options, but I wanted to fix this once. I didn't want to have continual issues. Now I know that, you know, depending on each person's set of circumstances and all of that, but I wanted to give myself the best options possible. And after my research and what I looked into, and then after meeting Dr. Levine and the entire team that I knew would be dealing with my case, I knew that that's what I would be doing for myself, is if I trusted him to do this, I would give myself the best chance of the best outcome. And so thankfully that's exactly what happened. And you know, obviously you said 1,700 at least, and I'm sure there's many more than that, you know, people that want to talk about it and how great of an experience it was. Again, I just can't speak highly enough of it. And you know, we're all busy, and you just don't want to have a nagging issue that you have to keep trying to fix, you know, to get it right. And of course, I believe the older you get, it can become more and more difficult, because it's, you know, it's not as easy to heal and all of these things. So, you know, give yourself the best chance, the best opportunity, and I believe it's HSS with Dr. Levine.
Well, thank you so much again for having us in your home here again live from Philadelphia. If you have any other questions for Cristi, Dr. Levine, you know, we're happy to answer those even after this live broadcast. And if you want to check out Cristi's story, again, it's also on our Back in the Game patient forum, where Cristi was mentioning we have over 1,700 patient stories. It's the largest forum of its kind, and that's at hss.edu/backinthe game. So, Cristi, thank you again.
Thank you.
And thank you, everyone, for tuning in.